Hello, I'm Dr. Melanie Smith, board certified obesity medicine specialist at Advocate Aurora Health and medical director of the HMR program since 2010. I'm joined here by two of our expert HMR health coaches, Adam from our Germantown location and Samantha, who works alongside me in Burlington.
Today, we're going to share a few patient success stories while giving you an idea of what to expect should you decide to join one of our HMR programs. In addition, we'll detail the support and accountability that we provide every step of the way.
We know the decision to start any kind of diet or exercise plan can be a very personal and not always easy choice to make. Our ultimate goal is to make our patients feel as comfortable as possible.
This program is so much more than a quick fix when it comes to weight and health management. HMR's innovative approach is rooted in behavioral science. Hundreds of thousands of people have discovered that HMR offers a powerful yet simple approach to losing weight and keeping it off. As a family practice physician, I was seeing hardworking patients looking for ways to improve their weight and health, but just not sure how to get started or how to make it last. After researching various weight loss options, I ultimately decided to bring the HMR program not only to my practice, but across Advocate Aurora Health. Since 2010, we have grown our HMR in-clinic services throughout the Advocate Aurora footprint with dedicated staff to support you. In my practice, I see many patients in need of achieving a healthier body weight in order to improve their health and long-term goals. What may surprise you is that as little as 5 to 10% reduction in a patient's weight, we can see tremendous improvements in some of the most common health concerns. One of the ways we remove the guesswork is by utilizing HMR's full line of meal replacement products, including shakes, entrees, soups, cereals, and bars. We begin the program using the meal replacements for a variety of reasons. They are quick and easy to prepare, as well as nutritionally dense, which helps you stay full and satisfied. They can be consumed alone or paired alongside your favorite vegetables and fruits, depending on the plan you select. The best part is they are shelf-stable and portable, making them great on the go. Now, you may be getting curious if this journey is right for you. Adam and Samantha are going to provide you with more information on exactly what to expect on the HMR program.
Each HMR site is staffed with coaches who will provide you with a high level of support and accountability so you can achieve long-term goals. We facilitate weekly meetings, which we discuss the behavioral skills needed for permanent results. The meetings give you an opportunity to connect with a group of individuals who are working towards a common goal, establishing a healthy lifestyle. One of the things I ask prospective patients is, what are your reasons for wanting to lose weight? Or perhaps, what inspired you to check out our program? We call these your whys, your motives to pursue better health, develop a healthy relationship with food, and to embrace an active lifestyle. Take a moment to think about your whys. I wouldn't be surprised if your whys relate to quality of life improvements. Maybe you're a new grandparent and inspired to get a new lease on life. Maybe you're on medications and want to get off of them. Or maybe you're just sick and tired of being sick and tired. Whatever your reasons, you can expect these positive changes early in the program, along with your weight loss goals. It's not uncommon to start feeling better immediately. To help you better understand how this program works, I'm going to share the process through the lens of an HMR patient, Julie. Before HMR, Julie was always active, but ate whatever and whenever she wanted. She also justified her unhealthy food choices. Her decision to join HMR came through her Aurora doctor. She had blood work done for a minor surgery. The results: her kidney function came back abnormal. Her liver was showing signs of fatty liver disease due to being overweight, and her cholesterol was very high. Julie's doctor told her everything she was dealing with was due to her weight, and she needed to change her eating habits and exercise regularly. Julie knew from past diets she needed a structured diet with supervision to succeed, and that's when her doctor recommended the HMR program at our site in Burlington, Wisconsin. There are two different diet plans you can choose from. The first is our decision-free plan, which is what Julie selected. It's our most structured plan, and it's exclusively made up of HMR foods: shakes, entrees, soup, hot cereal, and nutrition bars. No other foods. As our most structured plan, it requires the least amount of decision making, hence the name, and it requires the least amount of work to prepare your foods, since HMR does it for you. The decision-free plan includes different levels of medical supervision depending on your needs. You can see through Julie's commitment, she transformed very quickly with the decision-free plan. After 12 weeks, down 41 pounds, and at 20 weeks, down 59.2 pounds. So what does a day on the decision-free plan look like? This chart gives you an idea of the diet structure Julie would follow for a day on the plan. You can see that Julie was consuming an HMR shake or entree every 2 to 3 hours. This helped her stay full and satisfied throughout the day. What's even better, if she were ever hungry, she could eat more of the HMR foods if she needed. We call this practicing more is better. The purpose of it? To stay full with nutritious, low-calorie HMR foods instead of giving in to the high-calorie and addictive foods that surround all of us in today's world. In summary, the decision-free plan consists of sticking to the HMR food, and you can have extras to help keep you on track, and that will keep your weight loss going for you. While we know this plan will work effectively for those who want a strict diet structure, it's not for everyone. Some people are going to need more flexibility to work with.
If it's more flexibility you desire, the Healthy Solutions Plan may be a better selection for you. Here is where I will introduce you to a patient, Lorelei, who truly embraced the Healthy Solutions Plan. Lorelei decided the Healthy Solutions Plan would be a better fit for her. This was a great plan for Lorelei because of her busy hospital shifts and love for cooking. The main difference on the Healthy Solutions Plan is how Lorelei incorporated 5 servings of vegetables and fruits along with her HMR meals. This allowed her to snack on veggies and fruits throughout her workday and when she was on the go. She was also able to use her skills in the kitchen to create some wonderful side dishes, such as roasted vegetables with her entrees and adding fruits to her shakes to create smoothies. Now keep in mind, this phase of the program is time limited. Our goal is to help you achieve fast, effective weight loss in phase 1. This is something we at HMR pride ourselves on. We know that losing weight quickly is motivating, and the data shows that quick weight loss produces more weight loss up front and more weight kept off over time. Based on the plan you'll choose, you'll need to eat a specific number of HMR foods each day. We call this your minimum prescription, and it will provide you 100% of your daily nutritional needs, and you'll purchase these foods weekly through your HMR clinic. HMR Foods gives you a lot to eat for very few calories. So if you're hungry, you can actually eat more, a lot more, and still lose weight. We like to say with this program, you always have something to say yes to, whether you're hungry or just want something to eat. Of all of the lifestyle changes you'll be making in this program, physical activity is the most important one for your health, and it can help you lose weight more quickly and keep more weight off over time. We also ask that you attend your coaching sessions every week. Working with your coach and group week in and week out gives you the support and accountability most people need to stay on track. And if you've had a tough week, the best way to turn it around is to attend your coaching session. The HMR staff can make all the difference in helping you reach your goals. So we'll ask you to commit to being in your group every week. Let's look over the structured phases of the program together. We have covered phase 1 through Julie and Lorelei's structures in the weight loss phase, where you use HMR foods as a tool to lose weight quickly. Now you may be wondering, will I be using HMR foods forever? Not at all. That's where phase 2 of the program comes in. Phase 2 teaches you to expand your skills with a wider variety of healthy foods, such as lean proteins, lots of vegetables and fruits, and whole grains to manage your weight and health over the long term. Many people think of diets as a short-term solution, and if you go back to the way you were eating before, well, that is how you will gain weight. So that's why phase 2 is so important. It supports you to keep practicing the healthier skills necessary to keep weight off through the inevitable changes of everyday life. I like to think of phase 2 as the insurance policy for the weight you have lost in phase 1. And finally, we have phase 3. Ultimately, our goal is to help you self-manage your weight with HMR as a support whenever, if ever you need it. Advocate Aurora offers a monthly class to support this phase of the program. Speaking of phase 3, this is where both Julie and Lorelei's journeys wrap up. Now they are focused on achieving new health goals while maintaining the progress they have made. Julie participates in our monthly class, where she and a fellow group of individuals are in contact and have access to our staff as they learn to manage their new body weights more independently. As you can see, the transformations of these ladies have been just incredible. I hope these real patient examples have resonated with you. Maybe they have you wondering, is it time for your transformation too?
I hope you're getting a real sense of how much support our program provides through weekly classes and customized coaching support. Let's talk program costs. This chart provides you with an idea of program expenses and can be broken down into 3 categories: medical, HMR food, and behavioral support. For medical, everyone enrolled will have a one-time health assessment. Beyond that, ongoing medical monitoring will be dependent on medical history, pre-existing conditions, and current medications. The costs and insurance billing options for these visits will be shared with you if applicable. Next, we have the HMR food. Food will cost about $120 a week, roughly $17 a day. Every week, you'll order a minimum requirement of HMR foods to support the diet plan you are following. Keep in mind the cost of the HMR food replaces much of what you may be currently spending on food. As you're losing weight, you'll be taking a time out from purchasing certain groceries and dining out. It's also worth noting phase 1 is a time-limited phase. Eventually, you're going to want more foods to work with to support your weight loss journey. At that point, you will transition to phase 2 of our program, which will result in less HMR food costs as you develop relationships with other healthy food. Last is the weekly coaching and group classes, which is $25 per week. This cost includes group class, individual support from your health coach, educational content to support lifelong changes, recipes, meal planning, activity tips, and we offer support and accountability tools like the HMR app and social media channels. I want to dive a little deeper into the HMR food costs. On the surface, $17 a day may seem a lot. Many tell us they're actually saving money while using the HMR foods because they eat out less. Some may spend more, but we know that no one spends nothing on food. When you think about the groceries, fast food stops, and restaurant meals you'd be replacing, the cost of the HMR foods can be quite affordable. And let's not forget to recognize the amount of calories you'll be saving. We could keep going, but I'm sure you get the point. While everyone's financial situation is different, we recommend breaking down your current spending, both groceries and out and about. This could be the best investment you make for you and your health. I want to invite you to listen to what's possible with the HMR program through a story of one more pair of participants, Jay and Terry.
Despite my physical job, I've always struggled with my weight. I also struggled with chronic pain, including fibromyalgia and osteoarthritis, and the weight wasn't helping. The more I exercised, the more pain I had, which ultimately discouraged me from being active, causing more weight gain. I've struggled with my weight all my life, and I've tried every diet that you can imagine. I would lose weight, but I never kept it off because I never really changed my lifestyle. The other diets I had tried never made physical activity a component, and I felt that that was the game changer for me. Even though I ate pretty well, I needed to take blood pressure medication and sometimes need a muscle relaxer at bedtime for pain. I felt horrible about myself and was often depressed. I felt like I could never get back to my college weight ever again.
I ate anything I wanted, but I hated looking at myself in the mirror. I hated my triple chin and stomach. I loved eating sausage, beef sticks, cheese, and sweets, and never made fruit and vegetable a priority in my diet. My job is very physical, so that helped me get a good amount of steps in each day, but I never made intentional exercise a priority. I was on blood pressure medication, and I used the CPAP machine for sleep apnea.
The expense was not an issue for us. We felt that we had to buy food anyways, so what was the difference if we bought HMR food or regular food? The expense was worth it to improve our health because eventually we would save in medical expenses down the line. Now that we've lost weight and established new healthy lifestyle behaviors, we both exercise daily. We can do activities outside together that we could not do before, and I love walking, hiking, and riding our bikes together on trails.
We now love trying new foods like fennel, kale, pomegranate, kiwi, butternut squash, spaghetti squash, and many more. We even increased the size of our garden to accommodate all of our new tastes and additions to our diet. We eat on an average of 8 to 10 servings of fruits and vegetables a day and focus on lots of variety. We both feel younger and have so much more energy. We can walk for longer periods of time without having to sit and rest because our feet and back hurt. We can now hike for a couple of hours and walk or ride a bike for more than 60 minutes. We can do activities with our 4 children and 3 grandchildren that we could never do before. If you're thinking about joining, take the first step and commit to the process. Stay focused on eating the food on the diet, and don't be afraid to eat more of the HMR food if you are hungry. Get the coaching and go to the meetings regularly. Learn from others how to change your life, and be sure to spend enough time in phase 2, the maintenance, to make sure that you set in your new lifestyle. You will make friends for a lifetime and never regret what you have done. It's life-changing.
We hope the results from our program participants show what's possible with the HMR program at Advocate Aurora Health. If you are looking for an option that doesn't involve as much support and accountability, we have self-directed options. There is an option to do the HMR program on your own or with the support of weekly virtual groups. With this program, your HMR foods are shipped by HMR directly to your home. Before starting, you'll want to discuss the plan with your healthcare provider, just as you would before starting any weight loss program. This is especially true if you're taking medications or have a condition that could be affected by diet or increased physical activity. When deciding which HMR option is right for you, the most important thing to consider which program will best meet your needs and help you achieve your health and weight loss goals. I want to wrap things up today by discussing next steps if you're interested in getting started. If you haven't already scheduled a consultation with an HMR clinic, you can do that right away by contacting the HMR clinic nearest you. We also ask that you complete a survey by scanning the QR code here. This will help us personalize your initial consultation call.
Thank you for taking the time to learn more about what's possible with HMR. We hope you got a real sense of what Advocate Aurora offers through the transformations of just a few of our role model participants who have changed their lives for the better. Our teams can't wait to help you achieve your weight and health goals.
All that's left to ask is, are you ready to become a healthier and happier version of yourself? If so, we'd love to help.